Around the world, we're now seeing an increase in the number of reported cases of COVID-19, especially in Europe and the Americas. Each of the last 4 days has been the highest number of cases reported so far. Many cities and countries are also reporting an increase in hospitalizations and intensive care bed occupancy. At the same time, we must remember that this is an uneven pandemic. Countries have responded differently, and countries have been affected differently. Almost 70% of all cases reported globally last week were from 10 countries, and almost half of all cases were from just 3 countries. For every country that's experiencing an increase, there are many others that have successfully prevented or controlled widespread transmission with proven measures. Those measures continue to be our best defense against COVID-19. There has been some discussion recently about the concept of reaching so-called herd immunity by letting the virus spread. Herd immunity is a concept used for vaccination, in which a population can be protected from a certain virus if a threshold of vaccination is reached. For example, herd immunity against measles requires about 95% of a population to be vaccinated. The remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. For polio, the threshold is about 80%. In other words, herd immunity is achieved by protecting people from a virus, not by exposing them to it. Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. It's scientifically and ethically problematic. First, we don't know enough about immunity to COVID-19. Most people who are infected with the virus that causes COVID-19 develop an immune response within the first few weeks. But we don't know how strong or lasting that immune response is, or how it differs for different people. We have some clues, but we don't have the complete picture. There have also been some examples of people infected with COVID-19 being infected for a second time. Second, the vast majority of people in most countries remain susceptible to this virus. Examples of people infected with COVID-19 being infected for a second time. Second, the vast majority of people in most countries remain susceptible to this virus. Seroprevalence surveys suggest that in most countries, less than 10% of the population have been infected with the COVID-19 virus. Letting the virus circulate unchecked, therefore, means allowing unnecessary infections, suffering, and death. And although older people and those with underlying conditions are most at risk of severe disease and death, they're not the only ones at risk. People of all ages have died. Third, we're only beginning to understand the long-term health impacts among people with COVID-19. I have met with patient groups suffering with what is now being described as long COVID to understand their suffering and needs so we can advance research and rehabilitation. Allowing a dangerous virus that we don't fully understand to run free is simply unethical. It's not an option. But we do have many options. There are many things that countries can do and are doing to control transmission and save lives. It's not a choice between letting the virus run free and shutting down our societies. This virus transmits mainly between close contacts and cause outbreaks that can be controlled by implementing targeted measures. Prevent amplifying events, protect the vulnerable, empower, educate, and engage communities, and persist with the same tools that we have been advocating since day one: find, isolate, test, and care for cases, and trace and quarantine their contacts. This is what countries are proving works every day. Digital technologies are helping to make these tried and tested public health tools even more effective, such as mobile applications to support contact tracing efforts. Germany's Corona Warn app has been used to transmit 1.2 million test results from labs to users in its first 100 days. The Arogya setup from India has been downloaded by 150 million users and has helped city public health departments to identify areas where clusters could be anticipated and expand testing in a targeted way. In Denmark, more than 2,700 people have been tested for COVID-19 as a result of notifications received through a mobile application. And the United Kingdom has rolled out a new version of its NHS COVID-19 app, which had more than 10 million downloads within the first week. As well as alerting users that they may have been exposed to a positive COVID-19 case, the app allows users to book a test and receive results, keep track of the places they have visited, and receive the latest advice on local restrictions. WHO is working with the European Centre for Disease Prevention and Control to help countries evaluate the effectiveness of their digital contact tracing applications. This is just one example of the innovative measures countries are taking to control COVID-19. There are many tools at our disposal. WHO recommends case finding, isolation, testing, compassionate care, contact tracing, quarantine, physical distancing, hand hygiene, masks, respiratory etiquette, ventilation, avoiding crowds, and more. We recognize that at certain points, some countries have had no choice but to issue stay-at-home orders and other measures to buy time. Many countries have used that time to develop plans, train health workers, put supplies in place, increase testing capacity, reduce testing time, and improve care for patients. WHO is hopeful that countries will use targeted interventions where and when needed based on the local situation. We well understand the frustration that many people, communities, and governments are feeling as the pandemic drags on and as cases rise again. There are no shortcuts and no silver bullets. The answer is a comprehensive approach using every tool in the toolbox. This is not theory. Countries have done it and are doing it today successfully. My message to every country now weighing up its options is, you can do it too. I thank you.
Thank you, Dr. Tedros. We will now open the floor to questions from journalists. I remind you that you need to raise your hand, use the raise your hand icon in order to get in the queue to ask questions. I would like also to remind journalists to ask, please, only one question to allow for more journalists to intervene. Let's start the first question with Kai Kupferschmidt from Science. Kai, can you hear me?
Yes, thank you very much, Fadela. This is probably for Bruce Aylward. I'm not sure whether he's joined already. I just wanted to ask whether you could give a quick update on where the COVAX facility stands, both in terms of who has, committed, signed the commitment, and in terms of the vaccines that have actually been, the vaccine contracts that have been signed.
Thank you, Kai. Can we come back to you later on? Bruce is in a meeting, but maybe Dr. Soumya Swaminathan can take this question.
Yes, thank you, Kai. The COVAX facility is going from strength to strength. October 9th was another deadline for countries to make commitments. And over the weekend, we have over 180 countries that have committed. These include the self-financing countries, and the latest one to join and make a public announcement was China. And then you have the 92 AMC countries, which will be eligible for Gavi support for the vaccines. So actually, when you add up all of these countries together, they represent 90% of the world's population. So it looks like the COVAX facilities really brought countries and people together, and it sets a good example for believing in and trying to achieve equitable access of vaccines. The second part of your question was about investment in vaccines, I think. Now, the facility will be looking at the broad range of vaccines that are out there, all of those that are being developed, particularly those in the late stages of clinical trials. As you know, CEPI has 9 candidate vaccines in the portfolio that they have supported the R&D for. 3 of those are in phase 3 clinical trials. But the COVAX facility will be looking at a number of other candidates as well as the data comes out of the trials. And then they will be making decisions on advanced market commitments for several of those vaccines. And again, there'll be an external advisory committee that is going to advise the COVAX facility to make those investments. So at the moment, it's looking good. On the funding side, there's still a shortfall. We need to get 2 billion doses, $2 billion, by the end of this year, and another 5 billion next year to supply just the AMC 92 countries, which will be able to provide them, for up to about 16-17% of their population. So there's still a bit of fundraising to be done, but I think the commitment seems to be there. Thanks.
Thank you, Dr. Swaminathan. I would like now to invite Bianca Rottier from Globo for the next question. Bianca, can you hear me?
Hi, Fadela, can you hear me?
Very well. Go ahead, please.
Thanks a lot. Despite the fact that Brazil has reached 2 sad and very symbolic milestones in the last days, like more than 5 million cases and 150,000 deaths, the numbers are clearly declining. Can WHO now comfortably say that the pandemic in Brazil has already reached its peak? And what lessons can Brazil learn from what we are experiencing now here in Europe with record numbers only months after the reopening? Thanks a lot.
Thank you, Bianca. I would like to invite Dr. Ryan to take this question.
Yes, well, we are pleased to see the numbers stabilizing and going down in Brazil, but remember, they're stabilizing and going down from some very, very high numbers, and there are still many people getting COVID-19 in Brazil and across the Americas. While there has been an overall downward trend in Central and South America, there are a number of countries in which that trend is still upwards. Again, we congratulate the frontline health workers in Brazil for what has been a very, very long and continues to be a very long fight, and also the communities in Brazil for continuing to work to try and reduce the spread of this disease. But as we've all learned at the School of Hard Knocks over the last number of months, is the fact that disease is on the way down does not mean that disease will not pick up again, and very, very quickly in certain circumstances. So we need to remain vigilant in all countries, and there needs to be a high index of suspicion as numbers go down to make sure that you detect areas in which the numbers may be going up. Brazil, very, very large country. It's almost the size of half a continent. So saying that the disease is on the way down in Brazil is a positive thing, but that does not mean in other certain areas that the disease is not on the way up, and therefore local authorities, state authorities will have to remain vigilant over time. So yes, we're always glad when a country like Brazil, that has so many people and contributes so much to the global economy and global culture, is gaining some success, but no country is out of the woods yet, and everyone needs to remain vigilant.
I think that Dr. Van Kerkhove would like to add something.
Yeah, just very briefly, not specific to Brazil, but specific to all countries, in that where we are in this pandemic right now and what we have learned, and Brazil is no different, is we're so far advanced in terms of our knowledge about how to deal with this virus, and as you've stated, there is a decline that we are seeing across in Brazil and in a number of countries, while in others that we are seeing a resurgence. I think the knowledge that we've all gained on not just what to do, but how to implement this is just as important. And so this feedback mechanism about looking at how all of these interventions have been applied in each country at the subnational level, and how those measures were put in place, how the measures are being adjusted as we go through this calibration period of opening up societies while keeping transmission at a low level, while applying the tools we have for active surveillance and case finding, is really quite critical. And that feedback loop, that learning loop,